You may have done it before. You worked around the house or you played sports, and then all of a sudden just a pain hits you. And sometimes it takes a professional to figure out if you've actually broken or fractured a bone. I was just saying,
if not all the time.
Right. I've had stress fractures in the past, and I've actually had to go in and get an ultrasound to see, and actually you could see the stress fracture. Yeah. It's very painful, by the way.
Well, thank goodness Drs. Ulysses Militano and Dr. Julie Barre are part of the team at First Coast Orthopedics, and they're here, which is part of the Orange Park Medical Center Network. Welcome, both of you. Nice to see you guys.
Great to be here.
And like she said, I had the same. I was jumping off of a terrace in Paris onto a rooftop in a film From Paris with Love, and 15-foot drop, and the fifth time out I was tired. I landed wrong. And I just kept saying, because we still had a couple weeks of shooting left to do, so I'm like, it's just a sprain, it's just a sprain.
Flesh wound.
Let me just, go home or whatever. And it just, I couldn't put any pressure on it. I've had a sprain before, but it's such a wide, you don't know what is going on. You really need to go in and find it out. But that brings us to you guys.
The experts.
And you guys are the specialists. So tell us a little bit about what both of you do, because you both have your own specialties, right?
Yes, so I'm fellowship trained in orthopedic trauma, and essentially that's an extension of the general training that you get in orthopedics, and emphasize more on fractures and fracture care. So the really bad stuff, usually you don't want to come and see me, but if you have to, then I'm the man to see. The pelvic fractures.
So we don't want to see you, is what you're saying.
You don't want to see me, exactly. Nobody ever wants to see somebody looking down at them when they're on the stretcher, but the difficult fractures like the pelvic fractures, the periarticular fractures around knees, foot and ankle, things like that the general orthopedists aren't comfortable taking care of, that's my thing.
Right. And I do general orthopedics as well as I'm fellowship trained in sports medicine. So some of the things that would be more of your sports injuries or, tennis injuries, rotator cuff tears, things like that, knee ligament injuries. Also, I specialize in shoulder replacements and things like that for, some older patient injuries.
Well, you have the elderly patients who might, fall and hurt themselves, but also with the kids going back to school, playing sports and whatnot. We start to see more of the fractures and whatnot. So that's why you guys actually have a fracture clinic. One just opened up in Fleming Island. So if somebody finds themselves in this sort of situation, they can go right to you versus going to the emergency room. Exactly.
That's something that we decided to start as a new concept in the Jacksonville area. We're not aware that it exists with any other of the practices, but it's essentially an urgent care for patients that have orthopedic injuries to kind of go someplace and get directed care for their individual problems, whether it may be the potential for a fracture, potential for a ligamentous injury or something like that, but they're still somewhat ambulatory so that they can get themselves there without utilizing EMS.
What are some of the signs that we should be looking for? Like with mine, it was pretty excruciating, and it took over a little bit of time. I'm like, you know what, I should probably go in and get an MRI. But what kind of symptoms should we be looking for breaks and fractures and these types of things?
I think essentially when you have a spill, you have your injury occur, it really boils down to, is it something that's really bothering me? Is it something that is keeping me from being able to get around? And if you are able to do that general, assessment yourself, and you feel better, then maybe hold off and go in a couple of days. But if it's really something where it's excruciating, there's deformity, you can't walk on it, then you probably want to get in and be seen as soon as possible.
And how do we prevent these sort of things if parents are watching now or grandparents are watching and their kids are weekend warriors and they're into sports and whatnot? Obviously things just happen, right. But are there any preventative steps that we can say, hold on, wait a minute, let's stretch or something before they head out the door?
A lot of injuries can be repetitive type in nature, and weekend warrior type injuries where we're doing a certain exercise, cycling, or you may be doing some technical errors and things like that. Stretching, obviously, beforehand, oftentimes will alleviate potential for strains and sprains and things like that. But certainly we're limited in what we can do if an injury occurs, like you said.
Yeah. Sometimes things just happen. Kids are going to be kids. You know how I broke my foot?
No.
Walking upstairs. You have all these athletes.
That's the worst story. You want to at least have like a story.
Right, you jumped out of a window while shooting a movie, a national movie. I broke
my talus. It took a few months to
broke my foot walking upstairs.
Upstairs.
Anyway, it is what it is.
Well, let's talk about one other thing too, which is really cool, because right now, for the most part, people will go if like they're in sports and something happens immediately, they'll go to emergency room or whatever. but these aren't specialists necessarily. They may look at it, they may do an x-ray, and then they're going to send you to a specialist.
Right.
But
Right.
you guys have facilities set up where we can go straight into you now, right?
Exactly. We've got 2 offices. The fracture clinic, or that acute care clinic, is sort of primarily based off the Fleming Island office. Then we've got a second office that's a little bit up the street from Orange Park Medical Center. And we basically have the ability to get these patients in immediately. So they can give us a call, or they can potentially walk in, so to speak.
Yeah.
Avoid a long emergency room visit,
Right.
if you will.
Right.
So,
And what are the hours? I'm sorry. Is that your regular hours, or is this?
It's the regular hours currently, so it's about 9 to 5. We are kind of assessing whether or not the need for extended hours will be useful.
But it's great to know that that option is there.
Yeah.
So thank you both so much for being here, and
It's
we
great
want
to
to
be
thank.
here.
Yes, thank you, and thanks so much to the Orange Park Medical Center, of course, for sponsoring this segment.
Visit firstcoastorthopedics.com for more information, and remember that you can just walk into the fracture clinic or call them at 904-269-6565 for an appointment.